Hello class, welcome to the introduction to the biosafety cabinet video. In this video, we are going to learn about the biosafety cabinets, their difference in comparison to the laminar airflow cabinets regarding usage, classifications, and structure. While sharing similar attributes like the use of high-efficient particulate air filters, or HEPA filters for short, which provides a clean air environment to work inside the cabinet, protecting the product from possible contamination. Both cabinets carry their own set of unique features and classifications that we're going to discuss further in this video.
Let's talk about laminar airflow cabinets.
Laminar airflow cabinets, or LFCs, can be divided into two categories depending on the airflow pattern, which can be horizontally or vertically. Both categories push air unidirectionally inside out towards the operator. The laminar airflow cabinet collects air from the environment with the blower located inside the cabinet. In the case of the vertical laminar airflow cabinets, the blower is located at the top of the cabinet. Therefore, it will collect air from the top. In the case of the horizontal cabinet, the blower is located at the bottom of the cabinet and it collects air from the bottom. Although in some cases, the horizontal LFCs have blowers located at the top of the cabinet as well. The flow pattern of the vertical LFC will be the following. Unfiltered air will enter the cabinet through the blower, will pass through the HEPA filter, and the now clean air will enter the working area from the ceiling. The clean air then will move towards the operator and back to the environment. In the case of horizontal LFCs, the unfiltered air will be collected either from the top or the bottom depending on the location of the blower, passes through the HEPA filter located at the back of the cabinet, and then the filtered air will enter the working area and then the air will go back to the environment. It's worth noting that some LFCs have a UV light incorporated to their system to sterilize the interior of the cabinet prior to their usage. The laminar airflow cabinets, with its unidirectional airflow pattern that flows through the system at a constant pressure and speed, prevents unfiltered air from entering the cabinet. It also provides protection to the product and the process taking place inside the cabinet. However, it does not provide protection to the operator. In fact, some LFCs do not count with a window sash to protect the operator. So, what kind of operations can take place inside of an LFC, taking the previous information into consideration? Some operations that take place inside of an LFC are non-hazardous processes, such as media preparation, plant tissue culture, sterile non-hazardous work like compounding IV, antibiotic admixtures, and transferring sterile solutions from manufactured packaging into syringes for patient administration, and other sensitive equipment. In general, I would say that laminar airflow cabinets are more used in pharmaceutical applications than in cell culture.
Biosafety cabinets.
In comparison to the laminar airflow cabinet, the classification of the biosafety cabinet will depend on the level of protection that it provides. Beginning with Class 1 biosafety cabinets. Biosafety cabinet Class 1 provide the lowest level of Bsc protection available because dirty room air is constantly entering the cabinet and flows across the work surface. Class 1 biosafety cabinet protect people and the environment, but do not protect samples for contamination and should never be used if there is a risk of airborne contamination. These cabinets are appropriate for low to moderate risk biological agents, or those rated at a biosafety level 1 and 2. Class 2 biosafety cabinets protects people, the environment, and the work samples. These biosafety cabinets are divided into 4 subtypes: A1, A2, B1, and B2, depending on the airflow speeds and the exhaust systems. Like Class 1 BSCs, Class 2 BSCs are appropriate for biosafety levels 1 and 2, with the addition of biosafety level 3. Class 2 biosafety cabinets feature a dual or triple HEPA filter system to safely handle the air exiting the containment unit. In this table, we can appreciate the difference between the types of BSC classes depending on the air circulation. Class 3 biosafety cabinets provide the highest level of protection possible. They protect people, the environment, and the work samples, and then can be used with extremely infectious biological agents. Class 3 BSCs are fully sealed, airtight cabinets that put a comprehensive physical barrier between workers and the substance they're handling. Long and heavy-duty rubber gloves stretch from the outside to the inside of the cabinet, allowing the lab work to be conducted without touching dangerous materials. Class 3 biosafety cabinets are the only type of BSC appropriate for working with biosafety level 4 materials, but they can also be used to work with the BSL agents previously mentioned. In this video, we just learned how to differentiate between laminar airflow cabinets and biosafety cabinets, their components, what agents can be handled inside of the different BSC classes and types, and what operations can take place inside of them.